what happens is the loader taper stem, the characteristics are, most important thing is it's a wedge. Okay, wedge where, consider this is as the bone cement. Okay, this is the bone cement. The femur stem is wedged into the cement. Okay, that is the reason it will always have a taper. Okay, in two planes, either one or two planes. Okay, it gets lodged as a wedge in the cement mantle. Okay, and the stem is allowed to subside initially. Once there is subsidence of the stem, okay, there are forces which develops radially, okay, all across, that is transmitted via cement, and that is where it gets transmitted from to the bone. Okay, and the distal tip, what Dr. Abhinav was pointing, okay, this tip is the distal centralizer where the stem is allowed to subside within that air pocket. Understood? Okay, this is very important characteristic of a cemented stem. Okay, for a loader tip. Okay, it is tapered. It acts as a wedge in the cement mantle. Okay, it is allowed to subside initially. Okay, and how does it act? Upon loading, the radial compressive forces whichever it generates, it is transmitted onto the cement, then via cement it is gone onto the bone. And the distal tip, what it was radiolysis, what it was mentioned, it is the centralizer where the stem is allowed to subside. Okay, this is a characteristic of a loader taper. This is very important. Okay, understand this concept. Now we'll move on to the next system, that is load composite beam. Okay, how does a composite beam, okay, looks? The composite beam stem will have rigid bond between the cement and the stem. Okay, if this is your stem, the cement is all around. Okay, it is completely white out. What Dr. Abhinav said, it is completely white out. Okay, here the stem is not allowed to subside. Why? If it subsides, then there will be breakage of the cement mantle. So to prevent subsidence, they have used a collar. Can you see this collar? Okay, so that is the reason you have completely white out bone cement, right? And if presence of any void distally, okay, if there is void here somewhere, that means the stem is going to fail. Okay, in this kind of stems, you're not supposed to use a centralizer with air pocket. Okay, the two differences are very clear. Okay, any doubts till now? Dr. Raghu has asked me what is subside means. Subsidence means a stem will, if for example, if this is your canal, if this is the bone cement, okay, and this is your femur stem, okay, this is first month. After say for 2 years, if this stem comes at this level, that means what? The stem is loose. Okay, but will not see stem loose. No, how will you say the stem is loose? By seeing that it was supposed to be at this level, now it has come this level. This much amount of subsidence is there. The stem is subsided so much. So that is the reason the stem is said to be loose. Okay, but again, there is a difference. Subsidence, that I'll discuss in the later part. We'll start analyzing the things again. Okay, now you understood the meaning of loader taper. and composite beam. So this is very important. Okay, this is very important. Analyze what stem is and what principle has been used. I cannot be using this stem, okay, and start having a subsidence in this. Okay, I cannot be same way. I cannot be using this stem and start having collar in this. Then it becomes mix and match of principles. This is very important. When you're using a stem, cemented stem, analyze what type of principle you're using. Okay, whether you're planning for loaded taper principle, if yes, it should be have a wedge. Okay, it shouldn't have any collar, because it gets secondary fixation when the patient starts weight bearing. It doesn't have primary fixation. That means as soon as you put the stem on operation theatre table, and next day when you make the patient to walk for next 6 months, it initially gets its fixation, not on the table. Whereas in composite beam, okay, the fixation is on table, and there is no secondary subsidence, there is no secondary fixation happening on the composite beam. Okay, how is this stem? It is collared. Okay, no centralizer. Okay, fully white out stem. That means entire thing is there. What does collar tells you? So the stem should not subside further again. So what principle has been used for this case? It is composite beam, right? So what to choose for which patient? Everyone is asking. It is based upon the stem design. Okay, what stem design you want, what stem design is available, that principle you have to use. Sir, many of the times this implant company guys will come and will give, sir, will give you centralizer, will give you cement, will give collar also, will give everything. We don't know what to use when. But what we know is, we know the principle. Okay, this stem has got it. If you see Chandley stem, okay, this is the Chandley stem. This is the original Chandley stem. This stem has one collar, small collar. Okay, it is not big like as it is appearing this much, but there is some step. Okay, I have extrapolated this stem. This part is little, some collar is there. It is not taper. If you see that previous Exeter stem, that was fully taper sharp. This is not taper. This is something a cylindrical type. Okay, the surface is not smooth as it was. Okay, the surface is little rough. Okay, so and here there is no whiteout and there is no centralizer given for this stem. Okay, so this means what? This stem is not allowed to subside. Whatever the fixation has to happen, it has to happen on the table. It shouldn't subside. If you are not allowed to subside, if it gets subsidence, that means it is loosened. Composite beam concepts works on initial stabilization on the table itself. Okay, this is very, 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 very important. Okay, this is very important. Composite beams. So the cementing should be perfect. It should be completely white out. No voids. If there is a void or air pocket, that means the cement mantle is weak.